My name is Galloway. I'll be your student physical therapist today.
Hi,
How are you?
I'm doing well.
Great. So I'm going to be asking you a few questions before we get started on the actual exam, and it's going to require me to write some notes down while you're talking to me. Is that okay with you?
Yes.
Great. So can I get your name and date of birth?
My name is Pat Johnson,
Mhm.
and I am 25 years old.
Oh, great. Okay. And what is it you do for a living?
I am a postal worker. I work about 6 days a week.
Oh, okay. Can you tell me more about what's involved in your work as a postal worker?
Yeah, for sure. I walk a lot, and my job also requires driving several hours a day.
Oh, okay.
Yeah.
That makes sense. Is there anything else you do when you're not? What do you do when you're not working in your free time?
Well, I work a lot, but I like CrossFit. I CrossFit about 3 days a week.
Well, that's really good. So you're staying active. Even
Yeah.
though you're working a lot. That's
Yeah, I like CrossFit. It's a good workout. Keeps me ripped.
great. I see that. Very good.
Thank you.
So what is it that's bringing you into physical therapy today?
I am having neck pain, and I'm also having pain in my hand, my right hand.
Okay. I'm going to ask a few questions specifically at that neck pain to begin.
Okay.
Well, first, could you show me exactly where it is?
Yeah.
Maybe point to it for me.
So it's like right through here, and it's just on that right side.
Okay. I'm going to draw it there. Would you say that's a good representation of where it is?
Yes.
Okay.
Mhm.
Any higher or lower than that?
No.
Maybe like into your head or down your spine, anything like that?
Mm-mm.
No? Right there?
Yeah, that one, and then I definitely have another pain that just kind of started up separately, but
Okay.
it is
Well, show me
here
again.
at
Yeah.
my right hand,
Okay.
like around my index finger, and I feel like some numbness and tingling at my palm.
Okay.
Yeah.
Would you say that's a good representation of it?
Yes.
Okay. Good. Do you feel any other pain like up your arm?
No.
In your bicep or forearm, anything like that? No?
Mm-mm.
Okay. Low back, you said there's no pain there?
None at all.
Okay, great. How would you describe the pain in your neck or scapular shoulder area?
Mm-hmm. That pain, it's constant. It happens all the time. It's right up my neck and around that scapular area
Okay.
you're talking about, shoulder blade.
Okay. Right now, just sitting there, how would you rate your pain on a scale from 0 to 10? 10 being the worst, 0 being no pain at all.
Right now, I'd give it about a 3 of 10.
Okay. And at its worst?
A 6 out of 10.
Okay.
Yeah.
And when you're feeling your best, how would you rate your pain?
I'd call it a 1 out of 10.
Okay.
That's pretty good.
So you said it was constant, so it's always even at its best, it's still a little nagging pain at 1 episode. Okay.
Yeah, that's pretty accurate.
And then going to your hand pain now.
Mm-hmm.
How would you describe that pain?
It's on and off, and like I said, I feel numbness and tingling right through this finger here and my palm. So, yeah, it comes and goes.
Numbness and tingle. Good. Okay. So this kind of comes and goes. Do you notice any type of relationship between when your neck pain comes on and then your hand pain? Do you think there is any chance they're related?
Well, it's definitely, the hand pain is definitely, well, I should call it numbness and tingling, is worse when my neck is hurting worse. So if this is really painful, this is going to hurt. But the numbness and tingling sometimes just comes on its own too. So it's not really dependent on my neck pain.
Okay, so sometimes there's a relationship, but sometimes not.
Yeah.
Interesting. What would you say makes your neck pain worse?
When I look down,
Mm-hmm.
and also like when I turn my head to look the other way.
Okay.
And I've definitely noticed that it hurts when I'm lifting, like doing CrossFit,
Oh, CrossFit,
and
yeah.
different things at home, and When I sneeze as well.
Sneezing,
It just
okay.
kinda hurts my neck, yeah.
Lifting and sneezing.
hmm
Okay.
And then looking down in routine.
Gotcha. So when that pain does start to come on and it does get aggravated, what do you do to make it feel better?
I usually sit straight up. That makes things feel a little better, and of course, massaging it feels nice.
What do you massage?
Just around my neck. Yeah.
Okay, right up there.
So yeah, this right here is usually pretty tight.
And then when you first wake up in the morning, would you say how would you describe your pain at that time when you first wake up?
It's actually pretty bad. It's like worse in the morning.
Really? Okay. And so it's worse in the morning. So that means throughout the day it's getting. Would you say better or worse after that?
Throughout the day, I feel like it gets better. Like I'm moving, and it just feels better than it does in the morning.
Does it affect your sleep at all?
It's difficult getting to sleep, like getting the pain to relax. But once I'm asleep, I'm fine.
Okay, great. So I have this medical history screening form that you filled out. I'd like to go over a little bit of it with you. I noticed that you marked that you have gotten some imaging. Is that correct?
Yes.
And do you know the results of that?
Yeah, my doctor said they were normal.
Okay.
So,
Great.
yeah.
And I see here that you have you're taking some medication, ibuprofen and Robaxin.
Yes.
Okay.
Correct.
Were both of those prescribed by your doctor? I know Robaxin is a muscle relaxant.
Yes. So when I went to the doctor, they gave me ibuprofen. It's about 800 milligrams.
Okay.
And the Robaxin was also given to me by my doctor. I took about 25 milligrams of that.
Okay. Do you know how often you take those medications?
I take them every now and then, but it's not really specific. I just kind of take it to help with the pain.
Okay, good. And on here you marked that you have pain. You said earlier, and you marked it here as well, that you have pain while sneezing, and and you have coughing as well. That increases the pain in both areas or just your neck?
Yeah, just in general, but mainly the neck.
Okay.
Yeah, it makes it hurt worse.
Great. And then I'm going to be going through a few. Actually, before I go there, can you tell me more about how you hurt yourself?
It happened a day after my CrossFit competition. I was deadlifting, and right after, I just kind of felt like neck pain, and it was like I had this radiating sensation like around my shoulder blades.
Radiating, okay.
Mm-hmm.
What did you do after that?
Well, this was about 2 weeks ago, and after that, I decided to go to the doctor, and that's where I got my medication, and I also got a injection.
Okay.
Mm-hmm.
Do you know what they injected you with?
Toradol.
Oh, okay.
Yeah.
Great. And again, was the numbness and tingling in the hand there after your competition, or would you say that came on
No,
immediate?
so
Was it immediate after your competition?
yeah, I just kind of noticed it happen. Like it wasn't immediate. It was like maybe 2-3 days afterward that I felt the symptoms of numbness and tingling at my right hand.
Okay.
And it hasn't really gone away since.
Okay. Gotcha. And have you had any other back or neck pain prior to this CrossFit competition?
No, I haven't had any injuries outside of this.
Okay. So you stated that you had difficulty competing and doing or completing like the CrossFit workouts. Is that something you'd like to get back to?
Yeah, that's definitely one of my goals, just to like be able to work out, and I want to be able to like turn my neck normally without it hurting when I turn and when I look down.
Okay, yeah, absolutely. Both of those seem within reason, and I think that's a great goal, and that's going to be my top priority as well to get you back to where you were. Okay.
Sounds good.
So throughout this process, I'm going to be teaching you like exercises and different things like that. Is there a specific way that you would like me to present the information to you, whether that's showing you or demonstrating or having you do it, just telling you about it, writing it down?
I think all those things sounds good. It just depends. I prefer like a mixture of all of those.
Okay.
So I'll let you know.
Do you have any barriers to learning that may
No,
Okay.
I don't think so.
Great. Is there anything else on the medical history screening form that wasn't on here that you'd like to discuss at this time?
No, I think it was all pretty straightforward.
Okay. So before we begin, what is your resting symptoms right now? How would you say your pain is on a scale from 0 to 10?
I'm at about a 4 right now.
Okay.
4 of 10.
Great. So for a small portion of this exam, I'm going to need you to remove your shirt if that's okay with you. It's going to give me a better idea of your posture,
Okay.
how your body's aligned, and I'm also going to be doing a neuro exam, which is going to require me to touch various parts of your body and test like the strength of your muscles. Is that all okay with you?
Yeah, sounds good.
Great. So if you don't mind removing your shirt. A few notes.
I feel like you're drawing me like one of your French girls.
No drawings. You wouldn't want to see any drawings of mine.
Guess that's why you're a PT.
Yeah, that's all right. No worries. Okay. If you could stand up for me now. Great. Great. Now, if you don't mind, can you walk to the door and back for me?
Yeah.
Okay. One more time, please. Perfect. Okay. You can take a seat. So for this part of the test, your eyes will be closed for a little bit of it, and I'm going to be touching one side of your body, then the next, and you're going to respond either yes or no. I'm going to ask if this side feels the same as this side.
Okay.
So you just answer yes or no, and then I'll tell you when to open your eyes, and then we'll continue from there, okay?
Okay.
Does this feel the same as this?
Yes.
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 Does this feel the same as this?
No.
What was different about it?
I didn't feel it quite as much on this side.
Okay, good. And then does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
Okay, you can open your eyes now. Now I'm going to be resisting, you're going to be resisting some of the movements I'm going to be putting you in. So we're going to start by bending your head forward, and I'm going to push you that way. You don't let me move you, okay?
Okay.
Ready? Hold, hold, hold. Good. Now if you could look towards me. Ready? Hold, hold, hold. Good. Now on this side, look towards me. Ready? Hold, hold, hold. You could side bend. Yep, perfect. Ready?
Mhm.
Hold, hold, hold. Good. This side. Ready? Hold, hold, hold. Show me your muscles. Nope, not yet. Yep, raise your chest forward. Keep it here.
Okay.
Elevate your shoulders. Good. Ready? Hold, hold, hold. Good. Arms out like this. Ready? Hold, hold, hold. Good. Now show me your muscles. Great. Ready? Hold, hold, hold.
I'm sorry.
Ready?
Get itchy.
Hold, hold, hold. Hold, hold, hold. Hold, hold, hold. Good. Hold, hold, hold. Hold, hold, hold. Hold, hold, hold.
This is a workout.
Hold, hold, hold. Good. Thumbs up. Great. Ready? Hold, hold, hold. Ready? Hold, hold, hold. Just here, don't let me do this. Ready? Hold, hold, hold. Hold, hold, hold. Good. Now don't let me separate your fingers here. Hold it. Ready? Hold, hold, hold. Hold, hold, hold. Hold, hold, hold.
This is challenging.
Good. One side. Hold, hold, hold. Hold, hold, hold. Hold, hold, hold. Good. Now, bring them together. Don't let me separate them. Ready? Hold, hold.
Sorry. That got
Hold.
confusing.
Ready? Hold, hold, hold. Hold, hold, hold. Hold, hold, hold. One more. Hold, hold. Good.
Thanks.
Now, just relax your arm. Here. And then
It's like a late reflex.
it's okay. Just relax. You look that way for me. Okay. Great. Now, give me your hand here. I'm going to just relax. Okay. So I just want to make sure we're not having any other problems in your shoulders and a few other places. So starting on this side, if you can raise your arm just like that, let me know if there's any pain and raise
In
it
front
as
of me?
high as you can. Yes.
It's fine.
Okay. I'm going to add a little pressure.
Still good.
Okay. Good. Right back down softly. Okay. And now out to the side.
Feels good.
Okay. I'm going to add a little more pressure. Good. Okay, bring it right back down. And now behind you, you put it like that. Yep. Now reach your thumb up your spine, just like this, as high as you can.
Mm-hmm. Feels good.
Okay. Add a little bit of pressure.
Good.
Good. Okay. Same thing on the other side. If you could raise that arm in front of you like that.
Not bad.
Okay. A little pressure.
It's good.
Okay. Now out to the side. A little pressure.
It's fine.
And put your thumb on your spine for me, so bring it up as high as you can, while keeping it on your spine, just like last time. Yep, perfect. And now,
Oh, sorry.
a little bit of pressure.
It's good.
Good, great.
Not bad.
Okay, can you put your arms up like this behind your head, and I'd like you to reach down, like bring your elbows towards your knees for me.
Okay.
Any pain in your back?
Not at all.
Okay, I'm gonna add a little bit of pressure.
Good. That's fine.
No pain there? Okay,
No.
great. Same thing, put your hands back behind your head and reach back as far as you can. Any pain?
No.
Okay. I'm going to have you cross your arms here. Lean back again. I'm going to add a little bit of pressure. Ready?
Yeah. Not bad.
Okay. So, now I'm going to have you, what I would like you to do next is we're going to see how much movement your neck is able to do with or without pain. You let me know when there is pain with these movements I'm going to ask you to do, okay?
Okay.
So first, I'd like you to look up as far as you can and let me know when there's any pain that comes on.
Actually, it feels fine. There's no pain.
Okay, good. Now I'd like you to tuck your chin towards your chest and down toward your chest as far as you can.
Ooh. That
There.
hurts.
Okay, if you don't mind, I'm going to put my fingers here. Oh, looks like 4 fingers. Great.
That's pretty strange. But I guess it's a good measure.
Okay. Now I'd like you to look to your right for me, so just follow. Yeah, with
Alright, hang on.
Move your neck.
Okay. Oh yeah, that hurts.
It does hurt?
Mhm.
Okay.
It hurts. Oh, that was weird. Around my neck and around my scapula, so shoulder blade, I should say.
Okay.
Same pain I had.
I'm going to have you do that one more time.
Okay.
Okay, now look to the right.
Yeah, that's about it for me.
What I'd like you to do is side bend, which just means like tucking your ear towards your shoulder this way. Let me get into position first.
I'm so sorry. I just had a weird thing in my throat.
All right. If you could side bend to the left for me, so bring your ear towards your shoulder.
Okay.
Got it. Okay. Now same thing to the right.
Ooh, that hurts.
There's pain there. Okay.
Yeah, and around my neck.
Okay. You can turn back to normal, and I will step. Okay. So since your flexion and right side bending hurts so much, I'm not going to do where I move your neck myself. We're going to do that at another time when it's not in so much pain.
Okay.
So if we could just start with the that was the normal limit. Yeah. So I'm just going to, if you could scoot forward a little bit more.
Okay.
Great. Okay. Now you just relax and let me do all the movement. Okay.
Okay.
Relax here. Let me know if there's any pain with this.
Not at all.
Okay.
That's good.
Then normal.
Mhm.
Okay. Lateral rotation. So if you could just let me do all the movement. Okay. So try to keep your shoulders straight.
Okay. Sorry about that.
No problem.
That hurts a little.
Okay. Come back.
Okay.
Well, how would you rate your pain with that on a scale from 0 to 10?
That took me up to like about a 7.
Okay.
Mm-hmm.
Did it affect your hand pain at all?
No, it was just the neck.
Just neck? Okay.
Yeah.
And then we're going to do right rotation.
Mm-hmm.
Go this way now. Keep your shoulders straight. Good.
Good.
Okay. That's the normal limits.
Mhm.
And now, finally, if you could just do, we're going to do left side bending.
Okay.
This way. Okay. Just this way. Any pain with that?
Mm-mm. It felt okay. I wouldn't say it felt good. It felt okay.
Okay. So now, if you could put your shirt back on for me.
Can do that. How's this thing go? All right, so what's next?
As you're doing this, be thinking about a type of movement that you would think would reproduce your neck pain, like a functional thing. This is something that you're doing like in your everyday life, or maybe in CrossFit, anything like that that you think, oh yeah, this is what brings on my symptoms?
Yeah, definitely the deadlift, because that's how I like hurt myself in the first place. And we do a lot of deadlifts at the gym, so
Okay, great.
that'd be a good one.
Well, about how much weight you usually deadlift?
A lot.
Okay. Well, we don't want to do any max work today.
Okay.
But I'm
That's
going to
fair.
have you lift a sub-maximal, I guess, weight. So
That's fine.
coincidentally, we have the perfect weighted box right here.
Okay.
So if you could get into your deadlift position.
It's not CrossFit, but I can do it.
Okay.
Okay. So.
Okay. Okay. And you can put it back down.
I can do that.
Great.
Good at picking things up and putting them down.
So, how was your pain with that?
It didn't feel good. I
Didn't feel very good.
really felt that at my neck.
Okay.
Not a good
Okay.
feel for me.
So, towards the. All right, we're gonna go back to that after I do a few more tests. I think there's a few things I could do to help you with your form specifically to help reduce that pain as you're deadlifting in the future.
Perfect.
But before we get into that, I'm going to do a few special tests. So if you don't mind. Okay, so you relax. I'm going to, before I start, I'm going to be putting my hands on your head again, and I'm going to be kind of like pressing down on your neck just so you know what to expect.
Okay.
You just let me know if there's any pain or reproduction of symptoms with those, okay?
Okay. I will.
Relax here.
Ow.
Okay.
Yeah.
Where was your pain?
Around my neck. It's that same pain
Same
that
spot?
I've had. Yeah.
Okay.
Mhm.
Okay. I'm going to do one more. I'm just going to bend slightly this way. Same thing.
Yeah, that hurts.
Okay.
Does not feel nice. It's the same thing right around my neck.
Okay. Now, if you don't mind, can you lay down for me?
Yeah, sure.
Yeah, with your head
Face
out
up
on
this
this
way?
side.
Okay.
Okay. Let me know if there's any pain, or let me know how this affects your symptoms.
Okay. Ooh, it actually feels nice.
Okay.
Yeah, I feel like the pain. Sorry, I didn't mean to hit you.
It's okay.
That was so strong. I felt like that pain in my neck and arm just kind of went away.
Oh, great. Okay. Now I'm going to be doing a. This test is just. I'm going to be moving your arm around. You just let me know how it feels.
Okay.
At some point, there may or may not be some like tensioning. You let me know at the first sign of any tensioning or stretching you feel down your arm. Okay.
Okay.
To make it more comfortable, I'm going to put this
Oh,
underneath
perfect.
your forehead here. Okay. Okay. And is it okay if I reach just under your shirt to feel where your pain is?
Sure.
Okay, great. Let's see. Right. How does that feel?
Not bad. Feels okay.
Okay.
Yeah. That right side is tender.
Okay. Okay, I'm just going to be pressing here, all the way up to here. You just let me know. Remember to wiggle your fingers if you have any pain with that, and then I'll address it further.
Alright. Give me just a sec. I'm gonna mess with this a little more.
Sure.
Perfect. Thank you.
Good.
Yeah, that's pretty tender.
Yeah?
Mm-hmm.
Okay. Okay. Now I'm going to go off to the side a little more.
Mm-hmm. Yeah. I feel like that's like achy.
Okay.
Mm-hmm.
Achy where?
Right over the area that you're pressing on.
Okay. Okay. I'll be gentle, moving away from that spot, going down a little more. What about there?
It feels okay. Right over that spot initially. It was
Okay.
achy.
Alright, I'm going to go to the left side now.
Okay.
How does that feel?
That same spot is like pretty achy. It's just not. I wouldn't say it's as bad as the right side.
Okay, that makes sense. Good communication. Okay. There's a little muscle guarding. Okay, I have a good idea of what's causing your pain to get better and worse. So I'm going to do a little pressure. You let me know how your pain or symptoms respond to this.
Okay.
Okay?
Sure.
Okay, how are you feeling there?
That actually felt nice. I felt like my pain went down. The pain at my neck decreased.
Okay. Okay, we're gonna do that 2 more times. Okay. Same question, are you still doing okay?
Yeah. Yeah. It still feels just about the same. My pain's not as bad.
Yeah. Okay, one final time. Moved your hands there, are you feeling okay?
Mm-hmm.
Okay. If your pain comes on, you just let me know. And relax. Okay, if you can roll over onto your back for me. Adjust your pillow. Is it comfortable?
Yeah.
Okay, good.
Thank you.
I cannot find it in here. Okay, I'll just cut that. 5 bouts of 10 seconds. Static. Okay. Now, contraction, 5 bouts of 10 seconds. Okay, maybe one more time, or a few more times. And relax. Okay. Again, let me know if your symptoms get better or worse as we're doing this.
It's all felt pretty good. Feel a relief.
Oh, good.
My pain at my neck.
And one more. And relax. Okay, if you could sit up for me. Okay. How are you feeling?
Good.
Okay. Any dizziness or anything like that?
Mm-mm.
Okay.
Not at all.
Good. Now, I'm going to take this. I'd like to show you one more exercise. What I want you to do is put this around about that same spot that I was pushing on earlier.
Mm-hmm.
You're going to put it right around there, and then you're going to cross your arms this way.
Mm-hmm.
And you're going to have your left arm over your right arm, and you're going to pull this like across your chin. You're going to pull it to the side and kind of up. And I'd like you to pull it, hold it for 3 seconds, take it to its end range to where you start to feel some tension. Hold it for 3 seconds, and then relax. And then go back at it.
Okay. How many times am I doing this?
Let's say just one. We're going to do it 10 times,
Mm-hmm.
and that's it.
Okay.
Okay.
So you said.
So cross your arms first.
Yes.
Perfect.
Okay. So here.
Sure.
And
Yep, perfect.
that's the motion, right?
Yes.
Okay.
Sideways and kind of back.
Okay, so here.
Until you feel that tension. Hold
Yep.
it for 3 seconds, and then relax. Do it on your own.
So how many times a day am I doing this?
We're going to do it 3. Well, I'm going to get you a handout, but for now, I'm just going to tell you we're going to do it 3 times a day. So
Okay.
maybe like before every meal or after every meal, whatever fits your schedule. It really doesn't have
that
to
makes
be
sense.
around meals, but that's an easy way for people to remember it.
So as long as I'm doing it 3 times a day, I'm not in trouble?
Exactly.
Cool.
3 times a day, and then just like now, we're going to do it 10 times, and then stop. That's all you have to do. For now.
20. Kidding. That was 10.
Okay, great. I'll take this from you. So how are you feeling now, as far as your symptoms of your neck scapular pain or your wrist pain?
I definitely feel like, when you were treating that, the pain that I had at my neck went down
Okay.
a bit. So that was really helpful. And yeah, that's about it.
Okay.
The hand symptoms are still kind of there, but it's not too bad.
Okay. One final thing is I'm going to have you do the deadlift again.
Okay.
So the first thing I'd like you to focus on is bending more at the knees at the beginning of the thing. So you're going to get low, but you're still kind of keeping your back straight, okay? So then when you pick whatever it is up, whether it's a bar or a box, you're in this very low seated position. but you're keeping your back straight, and then also I want you to focus on keeping your head kind of up, so everything's like aligned. Do you see how my body is kind of?
Yeah.
Okay, and then shoulders back as well, like this. And then as you stand up, you're not going to just come straight up like that. You're going to really think about using your hamstrings and glutes to really pull it up, and then you're almost going to still try to stand up like that. So see, I was never too far forward as I was pulling it or anything. I try to keep my back straight the whole time. You almost want to slide it almost up your shins and then up your quads like that.
Okay.
Whatever you're picking up. So
Sounds
if you could
good.
demonstrate that for me. Good. Much better. Okay.
Thank you.
Can you do it with the box now, and then
Yeah,
let me know
yeah.
how your
For sure.
symptoms are.
Okay, so here, box,
Pick it up.
and we're up.
Okay. How was your pain with that?
Not bad compared to my first time doing that. Where I had the neck pain, that was actually pretty good. So
Okay. Great.
Yeah.
So I'm going to send you home with the exercise with the towel. I'm going to get that printed out for you.
Okay.
Do you have any questions about what we did today? Again, we're going to continue to work on on your goal of getting you back into the gym. Maybe not rush into it right now. Give it some time to heal. I think these exercises are going to help. But I'd say within probably less than a month, we could probably have you back in the gym.
Okay.
Depending on how well we'll take it week by week. But that's just my prognosis. I'd say 1 to 2 months.
Okay.
And then we can slowly start getting you back into the gym. Maybe not as heavy of a weight to start out, but we'll work into it. Okay?
Okay. That's good.
Do you have any questions for me? I have plenty of time.
No, I don't think so.
Okay, great. Let's get you to the front desk, and we'll schedule your next session. Actually, before I get you to the front desk, I told you how long it would take you to heal, but I didn't tell you what was going to be healing. So there's a disc in between each vertebrae of your spine. And I think with the compressive loads of deadlifting, it pressed on it, and it's causing some pain to kind of hit like a nerve root right there, which is actually sending pain down to your hand and also just your like scapular area.
Oh wow, that makes sense.
So just that compressive force on that. So what I'm doing is I'm doing movements that's kind of opening it up per se. So like where it is pressing on that nerve root, we're doing movements away from that compression on that nerve root. So it's opening it up and allowing that space for the inflammation to kind of go down.
Okay.
So given time and enough exercises and proper treatment, we should see the recovery of 1 to 2 months.
Okay.
Great.
Sounds good.
Now let's get you to the front desk.